Hello, my name is Maria Velasco Castro, and I am with Group F. And our group decided to do our presentation on the pathogen human immunodeficiency virus, also known as HIV. So, what is HIV? HIV is a complex virus that both attacks and weakens the body's immune system. According to the World Health Organization, there were 39.9 million people infected with HIV worldwide in 2023. And although there are currently no cures for HIV, there are many treatment options available, and with the medical advances there have been within the past decade, these treatment options have allowed people to live long, healthy lives, which was definitely not the case when HIV first discovered. And the medical advances that there have been have definitely made a difference in life expectancy. So HIV structure, so it begins with a lipid membrane, which is embedded with spikes, and these spikes are very important to the HIV cell structure. So it has two parts to the spikes. The top portion being the GP120, which is the surface glycoprotein, which is the receptor which binds to the CD4. CD4 being our white blood cells. Then it is followed by the GP41, which is a transmembrane glycoprotein, and this inserts itself into the cell's membrane, causing fusion and allowing the virus to enter into the host cell. Next is the matrix protein, which is the inner shell beneath the envelope, followed by the capsid, which is a cone-shaped protein that protects the virus's genetic material. And within the capsid, there are two identical copies of single-stranded RNA. And then within there as well is the reverse transcriptase, which is the enzyme used to convert the single-stranded RNA into double-stranded DNA. This is what it uses to integrate itself into the host's DNA, which is basically its mechanism to hijack the human cell and kind of take over and multiply.
Hi, my name is Kunsang from Group F, and today I will be talking about two different topics. The first one will be the 7-step life cycle of HIV, and the second one will be on HIV and human immune system. The first step we have is binding. The HIV cells first attach itself to the CD4 cells, also known as the cluster of differentiation 4 cells. This cell is one of the immune cells that protects our body. It does this by binding to special receptors of the cell surface. Second step is fusion. After it attaches, the outer envelope of HIV fuses or blends with the CD4 cell membrane. This allows the virus to enter the CD4 cell. Third step we have is reverse transcription. Once inside, the HIV uses an enzyme called reverse transcriptase to change its RNA to DNA. This step is important because it allows the virus to act like a part of the cell's own genetic material. Then after that, the fourth step we have is integration. HIV then uses other enzymes to push its new viral DNA into the DNA of the CD4 cell. Now the virus is officially a part of the cell and can take control. The fifth step is the replication step. So here the HIV uses the CD4 cell machinery to make long chains of HIV proteins. These chains they will eventually become new copies of the virus. Sixth step is the assembly. All these new pieces, HIV RNA and HIV proteins, move to the surface of the CD4 cells. Here they come together to form immature HIV. The seventh step we have is the budding step. The immature HIV pushes out of the CD4 cell. After leaving, it uses the enzyme called protease to cut and shape itself into mature HIV viruses. Now it is ready to infect more cells and starting the cycle once again. The second topic I have is how HIV affects the human immune system. So HIV mainly targets the CD4 cell and the T cells, which are important immune cells that help us fight infections. The virus hijacks these cells, meaning it takes over the machinery and uses them to make more copies of HIV. Over time, the number of CD4 cells drops because the virus keeps destroying them. According to the Well Project 2025, a normal CD4 count is between 500 to 1,500 cells per cubic ml. But for people with HIV, especially untreated HIV, the CD4 levels can fall below 200, which makes it much harder for the body to fight infection. So when the CD4 count gets very low, the immune system becomes weak, and this can lead to serious illnesses.
Hi everyone, my name is Tenzin and I'll be going over slides 6 and 7, which includes HIV signs and symptoms as well as the treatment options available for HIV patients. So in terms of symptom wise, it may not always show up. It may take weeks or even months for some people. Others may display early on symptoms. And these symptoms include fever that keeps coming back. You feel tired all the time. You're losing weight without even trying. You have swollen lymph nodes. And you're getting sick more often because the immune system is weaker. If HIV is not treated, over time HIV will damage the immune system and that can eventually lead to AIDS. Now, in terms of the treatment options available, ART is one of the treatment options. ART basically stands for antiretroviral therapy. It is a medication that HIV patients take. And there are two ways to take ART. It could be a pill form, taken every day, or it can be an injectable shot. You take it every 1 to 2 months. So you may ask, what does ART do? So if a person takes HIV medicine every day, the virus gets very, very low in their body. This is what is referred to as undetectable. It usually means the virus load is below 200 copies per milliliter. And the word undetectable is sort of misleading sometimes, but it means that it is untransmittable. So when a person's viral load is undetectable, it means that they cannot pass the virus to another person. So according to the source Stanford, conducted in 2025, if a viral load is below 1000, they state that the risk of transmission is extremely low. So basically what ART does is it keeps HIV under control.
On this slide, I'll explain how HIV is transmitted. HIV spreads through the direct exchange of certain body fluids, mainly blood, semen, vaginal secretions, and breast milk. The most common route is unprotected sexual contact, including vaginal and anal intercourse, because these fluids can easily enter the bloodstream through mucous membranes. Another major form of transmission is sharing needles or other injection equipment. When someone uses equipment that contains infected blood, the virus can pass directly into their bloodstream. HIV can also be transmitted from a mother to her baby during pregnancy, childbirth, or breastfeeding if preventative treatment is not used. It's important to note that HIV is not spread through casual contact. Now I'll go over effective methods to prevent HIV. One of the most important strategies is practicing safe sex. Using condoms consistently and correctly creates a strong barrier that reduces the chance of exposure to infected fluids. Avoiding the sharing of needles is another essential step. Using new sterile equipment every time completely prevents blood-to-blood transmission. Regular HIV and STI testing is also important because it helps individuals know their status and reduces the risk of spreading the virus unknowingly. For people who are HIV positive, maintaining a low or undetectable viral load through treatment is one of the best preventative tools. When viral levels stay below the detectable limit, HIV cannot be sexually transmitted.
Hello everyone, my name is Dakota Whitney. I'll be presenting the last 3 slides of our HIV presentation. Prevention medications. There are prevention medications called PrEP, which stands for pre-exposure prophylaxis. It is available in both oral and injection form. It has a 99% risk reduction when used correctly according to HIV.gov's website. It is all about personal preference to the research, so some people prefer taking the pills, some people prefer the injections. For example, the pills are less costly if you have very good memory and can remember to take it at the same time every day. However, people that want the injection, it's usually given about once or twice a month between 1 and 2 months, and it's actually way more costly. There's also what's called PEP, post-exposure prophylaxis, the plan B of HIV. So it's emergency treatment used ideally within 72 hours from time to exposure according to HIV.gov. And now the conclusion. So in conclusion, the combined research from HIV.gov, the Whale Project, and the World Health Organization demonstrates that effective HIV prevention and management depends on increased awareness, accessible medical tools, and continuous monitoring of immune health. Resources like pre-exposure prophylaxis play a powerful role in reducing the risk of HIV transmission, while the CD4 cell testing remains essential for understanding the progression of the disease and guiding treatment decisions. So it's basically basically letting people know what's going on, keeping them informed of medication, etc. There's also been multiple studies over the last few years of different medications, especially for the different populations of the world. Here are my references, so HIV.gov, the Whale Project, the World Health Organization, all up to date within the last few years. Tells you about pre-exposure prophylaxis, which I went over, the understanding CD4 cells, and the World Health Organization of HIV. Thank you for listening.